This video has been developed by the Women's and Men's Health Physiotherapy Department at Oxford University Hospitals. You may have received this video if you have been referred to our department by your consultant or GP. This video is not designed to be a standalone treatment, but to provide part of your physiotherapy management. Our contact details are provided at the end of this video should you have any questions regarding this information or your physiotherapy management. Hi, my name is Eleni.
And my name's Jo, and we're part of the Women's and Men's Health Physiotherapy team at Oxford University Hospitals. The aim of this video is to provide some initial education and advice to support the management of bladder conditions such as urinary incontinence, bowel conditions such as constipation or fecal incontinence, as well as problems with erectile dysfunction. We also hope that you'll gain an understanding of the role of the pelvic floor muscles, learn how to correctly activate the pelvic floor muscles, and how to develop a pelvic floor exercise program.
Firstly, we're going to talk about bladder symptoms and good bladder function. Let's start with urinary incontinence. Urinary incontinence refers to the unintentional passing of urine and is common, affecting 1 in 3 men over 65 years of age. You may have been referred to our team for support with managing urinary incontinence. There are 2 types of incontinence. The first is stress urinary incontinence and the other is urge urinary incontinence. You can also have a combination of both stress and urge incontinence. This is termed mixed urinary incontinence. If we consider stress urinary incontinence refers to leaking of urine with activities such as coughing, laughing, sneezing, bending, lifting, running, and jumping. These activities may generate increased pressure in your tummy, which may then place increased pressure on your bladder. Leaking may occur if the urethra, which is the tube through which we pass urine, is unable to remain closed against this increased pressure. With regards to urge incontinence, this refers to leaking associated with a desperate urge to get to the toilet. Patients commonly discuss needing to rush to the toilet and not making it to the toilet on time. Some patients may have particular triggers for this urgency and leaking. For example, urgency may be associated with approaching the front door or trying to undress next to the toilet, even when hearing running water or in colder temperatures. These symptoms are commonly associated with concern or worry about needing to go and where the closest toilet is. There are also other bladder symptoms that some men will report, and working on these symptoms may also form part of our goals of physiotherapy management. These may include going to the toilet all the time, which is called frequency, getting up frequently at night, bedwetting, and incomplete bladder emptying. When starting to address bladder symptoms, it can be helpful to know what is considered normal or ideal with bladder function. So let's have a look at this now. Ideally, we should be able to relax to pass urine without pushing or straining. For this to occur, the pelvic floor muscles need to relax, which allows the passing of urine to empty the bladder. We should empty our bladder around 5 to 7 times in 24 hours and be able to last around 2 to 4 hours between visits to the toilet. A good volume to pass when emptying your bladder is between 300 and 500 milliliters. These numbers are based on a recommended fluid intake of 1.5 to 2 liters per day and a similar predicted urine output. At night, the typical number of trips to the toilet can vary depending on your age. When we are younger, we may go once per night or not at all. As we get older, we may go 1 to 2 times during night. Over 65% of men over the age of 70 wake 2 or more times per night to empty their bladder. This is because overnight we produce a hormone which slows down kidney function and concentrates our urine. The production of this hormone reduces as we get older, meaning we are more likely to wake up at night to pass urine. As mentioned, some men may feel that they are not emptying their bladder completely or have difficulty emptying their bladder. Others find that urine gets trapped in the urethra only to leak out later when they are walking around. It is important that you empty your bladder well without pushing or straining. If you feel that you are having difficulty with any of these symptoms, there are a number of techniques which may help. Take your time and relax when passing urine. If you pass urine in standing, try sitting down and relaxing at the end to see if you pass any more. Some men will find that sitting on the toilet can assist them to relax more. Take a couple of deep breaths, letting them out slowly. After the first flow of urine finishes, sit a little longer. Try tilting your pelvis back and forth a few times, and then stand up and sit again. At the end, you could also try some pelvic floor squeezes. Contracting your pelvic floor muscles and then relaxing again a few times can also help. We will discuss the pelvic floor muscles in detail later in this video. Let's now think about fluid intake. As mentioned, around 1.5 to 2 liters is the recommended fluid intake per day. Some men will restrict their fluid intake because of their bladder symptoms, particularly if they experience urgency and urge incontinence. However, this can actually make symptoms worse. Your bladder is a storage area. Dehydrated urine irritates the bladder lining, increasing urgency and frequency. Good hydration can also help prevent urinary tract infections, headaches, constipation, dizziness that can lead to falls, confusion, kidney stones, and poor health. Your urine should be a pale yellow color, which indicates appropriate hydration. A darker color suggests you aren't drinking enough water. Other symptoms of dehydration include pain when urinating, commonly associated with urinary tract infection, dry mouth, lips, or eyes, thirst, dizziness, headaches, tiredness, lack of concentration. In general, it is recommended that we drink 6 to 8 glasses of fluids per day. However, this may vary depending the weather, environment, and levels of physical activity. Our body can lose hydration through perspiration, humidity, talking, and gastrointestinal upsets. Ultimately, the goal is to drink enough to produce 1.2 to 1.5 liters of urine per day. Water is the best source of hydration. However, you can also draw the necessary fluids from other drinks, including hot drinks, juice, squash, milk, soups, yogurt, and even fresh fruit and vegetables. In addition to how much you drink, it is also important to think about what you are drinking. Some drinks can aggravate the bladder. These may include caffeinated drinks, such as tea, coffee, green tea, hot chocolate, and energy drinks, some fruit juices, particularly citrus juices, which are acidic, carbonated or fizzy drinks, diet drinks which may contain sweeteners such as aspartame and alcohol. So what do we actually recommend? Try reducing or eliminating your caffeine intake, but please do this gradually rather than stopping all caffeine suddenly, as you can feel withdrawal symptoms if you usually consume a lot of caffeine. You may choose to switch to decaffeinated drinks, although it is important to be aware that these products still contain some caffeine. The chemical process used to remove caffeine can also introduce additional products that irritate the bladder. Try substituting tea or coffee with fruit or herbal teas. Try the changes for a period of at least 2 weeks and monitor any changes or improvement in your symptoms. Completing a bladder diary, which reviews what you drink and when you go to the toilet, can help to identify trends and better understand your symptoms. Your physiotherapist may discuss this with you further. Importantly, make sure you are drinking enough and that you do not restrict your fluid intake. We're now going to talk about the bowels for a moment. Constipation and straining with your bowels can make bladder symptoms worse. For example, a full bowel can put pressure on the bladder, increasing the urge to pass urine. 1 in 10 men experience constipation on a regular basis. As we did with the bladder, let's consider what's normal or ideal with the bowels. Normal frequency for opening the bowels is anywhere from 3 times per day to once every 3 days. The type of motion is more important than the frequency. On the Bristol stool chart, a type 4 is the ideal consistency. Keep stool soft and motions regular by having a good, varied, fibrous diet. This may be in the form of soluble fiber, which is found in fruit and vegetables, especially those with their skin still on, or insoluble fiber like grains, seeds, and brown bread. Try to open your bowels when you get the urge rather than waiting, as this can cause more water to be absorbed from the stool and make it harder to pass. The urge to pass stool generally occurs once every 24 to 48 hours. If you ignore this urge, it may not come again for another 24 to 48 hours. And lastly, avoid straining or breath holding when opening your bowels. Straining when emptying your bowels can put pressure on the pelvic floor. A good sitting position and avoiding straining is therefore important. The optimal position for bowel emptying is to sit on the toilet with legs comfortably apart and knees higher and wider than your hips. Placing your feet up on a small stool can assist in raising your knees. Then, lean forward, resting your elbows on your knees and keeping your back straight. Finally, allow your tummy to relax and swell, or gently bulge your tummy out. Holding your breath can also increase strain on the pelvic floor. Remember to keep breathing and, in particular, breathe out through your bowel motion. Most importantly, take your time. The more you rush, the less you relax. One other thing to consider when trying to improve bladder, bowel, or pelvic floor symptom is weight. Maintaining a healthy weight range is important, as increased body weight puts increased pressure on the pelvic floor. Losing weight may improve bladder or bowel symptoms. Aim to maintain your BMI between 18 and 25. So just to review, so far we have talked about stress urinary incontinence, urge urinary incontinence, constipation, and top tips to manage these conditions. Next, we will talk about the pelvic floor muscles and how to strengthen them.
There are a number of reasons why you may be encouraged to strengthen your pelvic floor muscles. Pelvic floor strengthening can improve symptoms of both urinary and fecal incontinence and can improve erectile dysfunction. Let's first look at where the pelvic floor muscles are and their role. The pelvic floor is a sling-like group of muscles that run from the pubic bone at the front of the pelvis underneath to the tailbone at the back. They get their name because they form the floor of the pelvis. The pelvic floor muscles encircle the neck of the bladder and back passage. The muscles tighten and close around these openings and also lift up to support the bladder and bowel. So, the pelvic floor muscles have important roles in both bladder and bowel control, supporting the pelvic organs, and also have an important role in sexual response. Bladder control is achieved when one group of pelvic floor muscles, the bulbocavernosus, tighten around the base of the penis, and a second group, the ischiocavernosus, draw the penis up and back against the base of the prostate and the transverse perineal muscle. The bowel is controlled by a separate portion of the pelvic floor muscles, including the levator ani and external anal sphincter, which tighten around the back passage. There are a number of reasons why the pelvic floor muscles may become weak. These include constipation, repetitive straining to lift or move heavy loads, and obesity, which can all lead to an increase of pressure on the pelvic floor. Nicotine from smoking or vaping, which may irritate the bladder and also cause muscle weakness. Chronic coughing, which can also cause repetitive stress on the pelvic floor. And pelvic trauma, such as from an accident, or pelvic surgery, such as prostate surgery, both of which may affect the muscles or the nerves that control them. Correct technique is essential when performing pelvic floor exercises. Many people attend our department thinking they're doing the right thing, but following an assessment are surprised to hear that this is not the case. Therefore, we will focus on establishing the correct technique first. To start with, position yourself either in lying or sitting. For sitting, sit on the edge of the chair with feet apart and legs wide. Lean forward slightly with either hands or elbows on your knees. Feel yourself tightening around the base of the penis as if trying to stop the flow of urine. Slowly draw the penis in towards your belly as if you were trying to retract the penis. Now focus around the back passage, pulling up and in as if stopping wind. Then fully relax and let go. Try standing in front of a mirror as you contract your pelvic floor. You should see the base of the penis draw in towards the belly and your scrotum or testicles lift. With each repetition, you are aiming for an evenly held contraction, should be breathing normally throughout, and should be able to talk easily. We want to avoid squeezing your legs together, clenching your buttocks, and tightening your abdominal muscles too much. A gentle pulling in of your low abdominals is okay. We also want to make sure that you can keep breathing throughout the exercises, so avoid holding your breath. Now that you understand the basic technique, we need to learn how to do long and short contractions. Long holds train for endurance, which is best for urge incontinence, and short squeezes train for power, which is best for stress leakage. For the timed contractions, we first need to establish how long you can hold a pelvic floor squeeze for. As we did before, tighten and pull up the pelvic floor muscles. Now, keep breathing and hold the contraction. When you feel the contraction starting to fade, fully release and let go. How long could you hold the contraction for before it faded away? This is your starting point. If you can already hold for 10 seconds or more, work with a 10-second hold. Now repeat this squeeze and try to work out how many you can do in a row, up to 10 repetitions. For example, your starting point may be a 5-second hold and 5 repetitions of this. Always have a 4 to 5 second rest between each repetition. Aim to gradually increase your hold and repetitions as you feel able to. A good goal is to be able to hold for 10 seconds with up to 8 to 10 repetitions, resting for 4 to 5 seconds in between each repetition. Let's now think about the fast contractions. This exercise helps to build the strength or power of our pelvic floor muscles so that we can react quickly for activities such as coughing or jumping. So, in your comfortable position, tighten and pull up the pelvic floor muscles, hold for only 1 second and then fully release. Rest for 1 to 2 seconds. See how many you can repeat in a row, ensuring a full release in between each repetition. The aim is to build up to 10 repetitions in a row. In terms of an exercise routine, the goal is to try and achieve 30 or more squeezes or repetitions of your pelvic floor contractions per day. For example, you may start with 5 long holds of 6 seconds, plus 3 short squeezes, and repeat this 4 times per day for a total of 32 repetitions. Progress the exercises by holding for longer and increasing the repetitions. Continue to do the exercises at regular intervals throughout the day. You can also progress your exercises by varying the position that you do them in. Aim to progress from lying to sitting and then into standing and moving around. Remember, you may be more fatigued at the end of the day, so make sure you do some of your exercises in the morning while you are still fresh. You may hear people talk about the knack when referring to pelvic floor training. The knack involves activating your pelvic floor muscles just before and during any activity which may increase abdominal pressure. For example, prior to sneezing, coughing, squatting or lifting. This helps to build the functional capacity of the pelvic floor and promote support of the pelvic organs during the activity. As mentioned, in order to build your pelvic floor strength, correct activation of the pelvic floor muscles is vital. We know that some people will perform the exercises incorrectly. For example, pushing down rather than tightening and pulling up the muscles, or maybe tightening or clenching their buttock muscles or tilting the pelvis. As part of your physiotherapy, you may be offered an assessment of your pelvic floor muscles. The best way to assess the pelvic floor is via a rectal examination. This assessment allows us to give you feedback about your technique and also about the strength and endurance of your muscles. Many men find this very valuable. As part of your follow-up consultation after watching this video, your physio will discuss this assessment with you, answer any questions, and allow you to decide if you would like to have this examination. After watching this section of the video, we hope that you will feel confident to start a pelvic floor strengthening program. Some key points to remember are: avoid breath holding whilst doing your pelvic floor exercises. The effort to engage your pelvic floor can vary depending on your position. It is easier to perform an exercise in sitting or lying, but gradually aim for a standing position. Avoid clenching buttock and inner thigh muscles while performing your pelvic floor exercises. Establish a regular exercise routine. Try setting reminders on your phone, use sticky notes, or download the NHS Squeezy app. If you have any concerns, please discuss them with your physiotherapist in your follow-up consultation. Finally, with regards to the pelvic floor exercises, remember that if you build muscle strength, you have to maintain it, or you lose the improvements that you've gained. Just like if you went to the gym routinely and then stopped going altogether. Once you've built up your daily routine of pelvic floor exercises, you need to keep going. Continue to avoid factors which can cause pelvic floor weakness. For example, if you have asthma, a chronic cough, or regularly get hay fever, using the NAC prior to coughing or sneezing can help prevent leaking. You can't always avoid lifting, but using the NAC to engage the pelvic floor muscles prior to and during movement will provide additional support. Repetitive loading, such as running and jumping, may increase the pressure on your pelvic organs and pelvic floor, meaning that you need to train your muscles to a higher level of strength to be able to do this. Low impact activities may be more appropriate whilst you're building up your pelvic floor strength. We hope that you found the education and advice discussed in this video useful. Just to recap, we have looked at 2 different types of urinary incontinence, good bladder and bowel habits which may help reduce your symptoms, the role of the pelvic floor muscles, how to perform a pelvic floor contraction and how to develop that into a daily exercise routine, and lastly, how to take this information and turn it into lifelong good habits. We hope that you've found the advice discussed in this video useful. Our aim is that you can take a few tips from this video and put them into practice, as well as start to develop a pelvic floor exercise program.
If you have been referred to our service, one of our team members will be in contact regarding an appointment with a physiotherapist where we will discuss your specific symptoms further and tailor your physiotherapy management.
Please contact us if you have any questions regarding this video. Our contact details are shown on the screen now. Our telephone number is 01865 235 383 and our email address is physio.womensandmenshealth@nhs.net.